Gentlemen, if you're over 60 and you've started to notice your drive isn't what it used to be, your energy fades faster, and your confidence in the bedroom isn't quite the same, listen carefully, because what I'm about to show you takes less than 2 minutes a day. No pills, no pumps, no embarrassment. Just your own body and one simple movement done the right way. It's called the heel glute bridge. And for thousands of my male patients, it's quietly restored blood flow, stamina, and control down there in ways most men thought were impossible after 60. Here's what happens when you start doing it right. Your circulation wakes up. Your pelvic floor, the hidden muscle that controls erection and orgasm, gets stronger. Your lower back and hips regain support, so nerve signals travel better. And suddenly, you feel more alive again. Sounds too simple? Let's get scientific for a second. An erection is not just about testosterone, it's about blood pressure and nerve flow working in perfect sync. When you sit too long, lose muscle around your hips, or ignore your glutes, that system breaks down. Blood doesn't reach where it needs to go, and performance suffers. The heel glute bridge targets exactly that problem. It activates the muscles that support the pelvic floor and the arteries feeding your most vital organ. It literally trains your body to send blood back to where it matters most. Hi there, I'm Dr. Amelia Hayes. I'm a board-certified urologist, and for the past 15 years, I've been helping men restore their circulation, their hormone balance, and their confidence naturally. Today, I want to show you how this one movement, plus a few lifestyle tweaks, can help you feel younger, stronger, and more in control than you've felt in years. Because this isn't about magic pills or quick fixes. It's about reactivating the engine you already have inside you, and it starts with a movement so simple you can do it on your living room floor. Stay with me to the end because I'll reveal the one adjustment most men miss when doing this exercise, and that tiny tweak is what makes the difference between just working out and truly restoring your vital performance. Ready? Let's get started. Let's be honest. Aging doesn't take away your masculinity overnight. It fades slowly, almost quietly, year by year. You wake up one day and realize things that once came easily now feel sluggish. You're not as hard, you don't recover as fast, and your morning energy just isn't the same. But here's the truth. It's not simply old age, it's science, and once you understand what's really happening inside your body, you'll see how to fight back. Everything starts with blood flow. An erection is a hydraulic event. Blood needs to rush in, fill the chambers, and stay there until the job's done. When your arteries stiffen, when your endothelial cells stop releasing nitric oxide efficiently, that smooth muscle inside the penis can't relax like it used to. So, instead of a strong pulse of circulation, you get a weak trickle. Then there's hormonal decline. Testosterone, your fuel for drive, stamina, and confidence, naturally drops about 1% each year after 40. By 60, you can have 20 to 30% less testosterone than you did in your 30 seconds. That doesn't just lower libido, it also shrinks muscle, slows recovery, and dulls your mental edge. But the most overlooked factor? Your pelvic floor and glute muscles. They're the foundation of male performance. These muscles support your organs, stabilize your hips, and control the blood vessels and nerves that run to your genitals. When they weaken, usually from too much sitting, everything suffers. Blood gets trapped or leaks back too soon. Nerve signals slow down, and the pump that used to keep things firm just can't do its job. Think of it like a car with low oil pressure. You can still drive, but the engine strains. You lose power and control. That's exactly what happens inside your body when circulation and muscle tone decline. Even worse, many men try to fix it the wrong way. Pills that give a quick temporary rush but do nothing for the real cause. They treat the symptom, not the system. What I want you to understand is this. Your body still has the potential to perform powerfully. You just need to retrain the system that controls it. That's why we start with movement, not medication. Because the right movement can literally retrain your blood vessels, your nerves, and your hormone-releasing pathways to work like they used to. And the best part? It doesn't require a gym, fancy equipment, or hours of your time, just gravity, your body weight, and the will to begin. In the next part, I'll show you the real powerhouse behind male circulation and why your glutes and hips might secretly hold the key to stronger, longer-lasting performance. Most men think performance starts in the brain or the testicles, but in truth, it starts much lower, right in the muscles that support your pelvis. Let me explain. At the base of your body is a network of muscles called the pelvic floor. These muscles are like a hammock that holds your bladder, prostate, and sexual organs in place. When they're strong, blood stays where it's supposed to stay. Signals from your brain travel fast. You can control timing and intensity. When they're weak, everything changes. Blood leaks out too quickly. You lose firmness, you lose control, and your confidence follows. Now, here's where it gets interesting. The pelvic floor doesn't work alone. It's deeply connected to your glutes, the large muscles that form the back of your hips. Every time you squeeze your glutes, you're indirectly engaging the pelvic floor, and when you strengthen both together, you build a powerful pump system that pushes blood upward through your pelvis and into your most vital area. Research backs this up. Clinical trials on men with erectile dysfunction show that training the pelvic floor can significantly improve firmness and endurance. Other studies prove that combining hip and glute exercises amplifies blood flow and nerve control even more. You're not just toning muscle, you're rewiring the entire circulation system below your waist. Think about how much time you spend sitting, 8, maybe 10 hours a day. That constant pressure compresses the very nerves and vessels that control arousal. Over time, those tissues become sluggish. They forget how to respond. That's why so many men feel numb or disconnected. By reactivating your glutes and hips, you restore mobility, you boost oxygen delivery, and you teach your body to redirect blood to the right places again. This is where the heel-glute bridge comes in. It's one of the simplest ways to switch all those systems back on. It doesn't just build your butt, it trains your brain, nerves, and circulation to work in harmony again. And the key, as I'll show you next, is how you place your feet, how you breathe, and how you engage the right muscles. Because one small adjustment, lifting your toes and pressing through your heels, can transform this from a basic workout, move into a powerful sexual health exercise. Let's dive into that next. Alright, gentlemen, here's the move that surprises almost every patient I teach, the heel-glute bridge. It looks simple, but when done the right way, it wakes up blood flow, nerves, and hormones in ways that pills can't. Here's how it works. You lie flat on your back, knees bent about 90 degrees, feet on the floor. But here's the key. Lift your toes slightly so all your weight sits on your heels. Now, press your heels into the floor and slowly lift your hips toward the ceiling. Don't arch your back. Keep your ribs down. At the top, squeeze your glutes tight for 2 full seconds. Then lower slowly. That's 1 rep. And when you do it right, you'll feel a deep contraction in your glutes, your hamstrings, and yes, your pelvic floor. That heel pressure is what makes the difference. When you drive through your heels, you automatically activate the posterior chain, the entire network of muscles that supports your pelvis and spine. These are the same muscles that control blood flow to your reproductive organs. Think of it like a natural pump system. Each contraction of those glute fibers pushes fresh, oxygenated blood into the pelvic region. That blood brings nitric oxide, hormones, and nutrients that keep tissue healthy and responsive. The science backs it up. Studies from medical journals show that men who strengthen their glutes and pelvic floor see measurable improvements in erection quality and stamina. Other research proves that even light resistance training can boost testosterone and nitric oxide levels, the same biological pathway targeted by most performance medications. But there's more. This exercise also decompresses the nerves that run along your lower back and pelvis. That means better sensation, faster signals, and more reliable control when you need it most. Here's what my patients notice after a few weeks. Their lower back pain fades, their hips feel stronger and looser, they stand taller, and in the bedroom, they feel full again, like the circulation has come back to life. You don't need heavy weights, you don't need a gym, you don't even need more than 5 minutes. What matters is consistency and technique. So, don't rush, don't just lift, engage. Each rep is a signal to your body saying, wake up, circulate, perform. Now that you understand why this movement works, let's build it into a real plan. In the next part, I'll show you how to combine the heel-glute bridge with other simple habits to create a full 8 to 12 week program that restores your circulation, your confidence, and your natural drive. Now that you understand how the heel-glute bridge works, Let's turn it into a full routine that rebuilds your foundation from the ground up. I give this same 8 to 12 week plan to my male patients over 60, and when they stay consistent, the results are remarkable. More energy, stronger circulation, and real confidence returning to their bodies. First, think of it as a 3-part formula: activation, strength, and flow. You'll train the muscles, re-educate the nerves, and reopen the blood vessels that feed performance. Here's how you do it. Step 1. Warm up. 2 minutes. Start by loosening your hips, march in place, swing your legs gently, or perform a few slow squats. This wakes up your circulation and prevents strain. Step 2. Heel glute bridge. 4 sets of 10 to 12 reps. Press through your heels. Lift your hips until your body forms a straight line from shoulders to knees. Hold at the top for 2 seconds and squeeze your glutes hard. Lower slowly. Rest 45 seconds between sets. If you can handle more, add a resistance band around your knees or do it one leg at a time. Step 3. Pelvic floor. Kegel for men. After your last bridge set, sit or lie down and perform 10 quick contractions. Tighten as if you're trying to stop urine midstream. Then 5 slow holds, each for 5 to 10 seconds. Relax between each one. Do 2 rounds total. Step 4. Cardio for blood flow. 3 to 5 times a week. Walk briskly or cycle for 30 to 40 minutes. Studies show that 150 minutes of moderate aerobic exercise per week can significantly improve erection strength and vascular health. Step 5. Track your progress. Every week, note your morning erection quality, energy level, and overall mood. You'll begin to notice small changes within 2 to 4 weeks. By week 8, you should feel a clear difference in circulation and control. Don't rush. It's not about doing more reps. It's about doing them with focus and consistency. Quality beats quantity. Many of my patients combine this routine with morning sunlight, hydration, and a dash of protein after their session. That combination helps testosterone production and recovery. Because no matter how strong your glutes or pelvic floor are, if your heart and vasculature aren't supporting them, you won't get full benefit. Aim for at least 150 minutes per week of moderate aerobic activity, brisk walking, cycling, swimming. Meta-analysis shows aerobic exercise improves erectile function significantly. If you can boost to 200+ minutes, even better. Men with worse baseline function gained more. Try to break up long sitting periods. Stand, walk 2 to 3 minutes every 30 to 45 minutes. Sitting compresses pelvic vessels and nerves. Subtle but serious for performance. Use cardio sessions to stimulate blood vessel rewiring. Better endothelial health, more nitric oxide release, less arterial stiffness. The same pathways that help your heart help your erections. Daily habits that fix hidden drains. Here's what many men overlook, and it eats into your performance quietly day after day. Sleep. Poor sleep lowers testosterone and raises cortisol, which automatically lowers your drive and reduces your nervous system's responsiveness. Stress control. Chronic stress floods cortisol, shrinks blood vessels, changes nerve sensitivity, and basically tells your body we're under attack rather than ready to perform. Posture and hips. If you're slouched, sitting long hours, your hips tighten, your glutes turn off, your pelvic floor gets lazy. That inhibits function. The glute bridge helps, but you must also fix posture. Weight control. Excess body weight, especially fat tissue, converts testosterone to estrogen, causes more inflammation, and worsens vascular health. Exercise plus diet creates synergy, monitoring progress. Take notes, morning erections, firmness, recovery time, write them down weekly. These are objective signals you're improving. Avoid quick fix mindset. Pills have their place, but when you rely only on pills, you ignore the root. Exercise plus lifestyle builds a long-term engine. Pills are emergency gear. Now, I promise you, putting all these together is what separates men who see real change from men who hope for change and settle. In the next part, I'll cover the warnings, when to seek help, and how to know if you need more than just movement and lifestyle, because knowing when it's more than simple habits is smart, not defeat. Now, before we go any further, I need to say this clearly. Because while this movement is powerful, it's not a miracle, and not every man should jump into it without guidance. If you have severe heart disease, uncontrolled high blood pressure, or you're taking nitrates for chest pain, pause. talk to your physician first. Any exercise that changes blood pressure or circulation should be cleared by your cardiologist. If you've had recent surgery, prostate, hernia, or spine, your tissues may still be healing. Doing bridges too soon can stress those areas. Wait until your doctor gives you the green light. If you feel pain in your lower back, sharp discomfort in your groin, or numbness down your legs while doing the exercise, stop immediately. Pain is a signal, not a challenge. It means your form is off or your body isn't ready yet. And here's another truth. If you've been struggling with poor erections for a long time, and lifestyle changes don't help after 2 or 3 months, there might be a deeper medical reason. Sometimes it's vascular disease. The same arteries that feed the heart also feed the penis. Sometimes it's diabetes, which damages tiny nerves and vessels. Sometimes it's hormonal imbalance, thyroid issues, or medications like beta blockers or antidepressants. A full evaluation by a urologist or endocrinologist can uncover these silent causes. Because yes, the glute bridge helps circulation, but if the pipeline itself is blocked or the hormones are off, you'll need a broader plan. Don't be embarrassed to ask for help. As a urologist, I can tell you we see this every day, and most of the time, the men who recover fastest are the ones who address the issue early, not the ones who pretend it isn't happening. So think of the heel glute bridge as your first step, your signal that you're ready to take ownership again. But if something feels wrong or results stall, don't push harder, get checked, because your body might just be whispering for deeper care. In our final part, I'll show you how to bring it all together: movement, lifestyle, and mindset, so you can reignite that full sense of strength and confidence again. Alright, gentlemen, let's bring this home. You've learned that male performance isn't lost with age. It's simply dormant, waiting to be reactivated. Every man over 60 still has the biological wiring for strong circulation, healthy hormones, and real confidence. You just have to wake it up. And that's exactly what the heel glute bridge does. It reconnects your body with its natural pump system, your glutes, hips, and pelvic floor, the very foundation of masculine vitality. Remember this formula. Movement plus circulation plus consistency equals power. When you press through your heels, squeeze your glutes, and breathe deep, you're not just exercising, you're retraining your body to send energy, blood, and control back to where it matters most. Add in good sleep, clean food, and cardio that keeps your heart strong, and you'll notice the change, not just in performance but in posture, mood, and confidence. Gentlemen, aging is inevitable, but decline? That's optional. So here's what I want you to do. Start tonight, lie down, plant your heels, lift your hips, and feel your body come alive again. Commit to 5 minutes a day, every day for the next 8 weeks. Then tell me what happens. Because I guarantee if you stay consistent, you will feel the difference in how you move, how you sleep, and how you perform. And I'd love to hear from you if you have questions about men's health, circulation, or performance. Drop them in the comments below. I personally go through them every week. If today's video helped you, hit that like button, subscribe for more weekly tips on men's vitality, and share this with a friend who needs to hear it. Because at the end of the day, the power to feel alive again isn't in a pill, it's in you. This is Dr. Amelia Hayes, reminding every man watching, you're not done yet, you're just getting started. And here's something interesting. Performing this routine in the evening can also improve sleep quality and next day's stamina. The glute bridge activates parasympathetic nerves that help your body relax and recover overnight. So, whenever you do it, morning or evening, make it a ritual, a signal to your body that you're retraining your engine. Up next, we'll cover the lifestyle boosters that make this exercise twice as effective, from nutrition to habits that reignite your blood flow and hormone balance. Now, gentlemen, this is where we connect the dots. You've got the movement, the heel glute bridge, locked in, but without the right lifestyle habits around it, you'll only tap part of the power. Let's talk about what else matters and why it matters so you can amplify your results. You already know circulation and muscle control are key, so we're going to add 3 domains: nutrition and hormones, cardio and circulation, and daily habits that fix what's silently draining your performance. Nutrition and hormones. First off, what you put in your body is what you get out. High-quality nutrition supports testosterone, nitric oxide, blood vessels, nerves, everything in the performance chain. Eat plenty of lean protein, fish, chicken, eggs, Your glutes and pelvic floor repair themselves after each session. Include healthy fats, olive oil, nuts, avocados. These support hormone production. Get your micronutrients. Magnesium, zinc, vitamin D. Low levels are linked to low testosterone and poor erections. Stay hydrated. Blood volume drops subtly with dehydration. And when blood volume drops, so can your firmness. Focus on foods that support vascular health. Leafy greens for nitrates, beets, berries, citrus. These improve endothelial artery lining function. Research shows aerobic exercise improves erectile function partly by improving cardiovascular and vascular health. Limit alcohol, quit smoking. Both interfere with blood flow and nerve health. Exercise alone helps, but if you're still smoking heavy, you'll blunt your gains. Cardio and circulation. Cardio isn't optional, it's foundational.